Rohit Masih and I'm an MD Medicine practicing in Guru Mission Hospital in Tahakalera. Today guys, I'm going to talk about diabetes, which is a very common disease. In today's session, we'll discuss about diabetes, its complication and its impact on heart, as well as preventive measures, how you can prevent diabetes and to prevent heart disease. At present, heart disease is the leading cause of hospitalization and death in patients with diabetes. Although most patients have heard about heart disease, but few understand exactly what actually it involves and in turn may not be taking proper steps to reduce their risk of heart disease. Heart disease occurs when blood circulation to the heart is stopped or it is reduced because of blockage in artery. What can be the reason to prevent an artery? One of the major risk factors is higher sugar level, which is known to be associated with diabetes. Let us know what diabetes exactly means. Diabetes is a lifelong disease. It simply means that the body ability to control blood sugar level in the blood is not adequate. So this condition in which the body has too much of glucose in your blood and the insulin levels are reduced or insufficient to cause the sugar to move back from blood into the cells. Let's understand what happens. Usually when you eat food, the glucose enters your bloodstream. From there, when it enters into the bloodstream, insulin is released from pancreas. Insulin helps sugar level to get reduced. How it does? It forces the sugar to go into the cells. So that is how, when there is a relative insulin deficiency or absolute insulin deficiency, insulin levels goes high. So now the question is how to effectively reduce it. This sugar level will cause high level in the blood and it will cause diabetes. So did you know how diabetes can increase your chance from dying from heart disease? Is it true with diabetes you are more likely to have a heart attack? So when it comes to diabetes, prevention is very important as it can affect your whole body from your eyes to your feet and especially your heart. In fact, people with diabetes are twice as likely to develop heart attack or stroke as people without diabetes. And it is reported that among diabetes people over the age of 65, approximately 68% die from heart disease. The chance of developing heart disease among patients with diabetes is not dependent upon how well you manage them or how well you control your blood sugar. So when we think about diabetes, we should really be thinking about heart disease as well. So moving on, let's see how blood sugar level leads to heart disease. High blood sugar can damage your blood vessels and worsen the cholesterol level and make blood pressure more difficult to manage. Persistently high blood sugar due to diabetes makes these blood vessels very prone to atheroma. A cholesterol clot is known as atheroma. This condition is narrowing of your blood vessel due to collection of bad cholesterol. The condition is a narrowing of blood vessel due to collection of bad cholesterol. When the blood vessels narrow, the blood flow has trouble reaching your different organs of the body, including your heart. A sudden stoppage of blood flow to the heart may cause a heart attack. There are a number of things you can do to lower your heart disease and risk. Understanding the connection between diabetes and heart disease is the first step towards prevention. Diabetes is commonly referred as lifestyle disease, and changing your lifestyle, such as eating healthy food, engaging in physical activity and regular blood sugar monitoring, quit smoking and relieve stress. Let us see each of these preventive strategy. Let us know the ABC of diabetes. So A is HbA1c testing. HbA1c is a blood test that measures your average blood sugar level over the past 3 months. It is different from the regular blood checkups that you do on day-to-day basis. You need to know your blood sugar levels over time. This HbA1c goal for many people with diabetes is below 7. So it may be different for you. So ask what your goal should be. So the B for it is blood pressure. Blood pressure is the focus of your blood against the force of your blood against the walls of your blood vessels. If your blood pressure goes too high, it makes your heart work too hard. The blood pressure goals for most people with diabetes is usually below 140 to 80. It may be different for you. Ask for your goal should be. C means there are two kinds of cholesterol in your blood. One is LDL and other is HDL. So LDL is bad cholesterol which can build up and clot your blood vessel. It can cause heart attack or stroke. HDL is a good cholesterol which helps remove bad cholesterol from your blood vessel. Ask what your cholesterol number should be. Your goals must be different for other people. So if you are 40 years of age, you may need to take statin drug for a heart failure. So eat healthy and well balanced diet. There is no one size fit. All approach to eat healthy diet should be followed, but it is important how to regular meal pattern and make healthy food choices. Your fat and carbohydrate intake are crucial to managing both cholesterol and diabetes and heart disease. So make simple switches from saturated to unsaturated fat. Having too much of saturated fat can increase your blood level cholesterol. So it is important to reduce the amount you eat and instead get fats from unsaturated sources. So the better opportunity will be switch butter, ghee for unsaturated vegetable oils and spreads such as sunflower, olives and rapeseed or corn. Trim visible fat from your meat and remove the skin from your chicken. Choose low fat milk and dairy products and swap biscuits, cakes and cookies for healthy snacks such as fruits. Remember, fatty foods are high in cholesterol and excess may result in gain. So to help manage your weight, it is important to keep an eye on total amount of calories and fat you are consuming. Different fat types have different effects on your body. Diet high in saturated fats are linked to higher level of bad cholesterol in blood. Eating unsaturated food instead of saturated fats help maintain healthy cholesterol level in blood. So eat right. Avoid refined wheat breads and potatoes, cereal, chips and fries, red meats and processed meat, saturated fats and sugar sweetened beverages. Eat food with more fiber such as whole grain cereals, dairy foods, beans and legumes, green leafy vegetables, fish, nuts, healthy oils such as olive oil. Choose fruits, cereals and low fat or skimmed milk and cheese. So, and the next step is cut down on salt. Too much of salt is linked to high blood sugar and high blood pressure also. A major risk factor for heart disease. Most of the salt we eat is already in a processed form. So check the label and go for those with lowest salt content. Learn how to read food labels, help you make healthier diets. Remove the salt shakers from the table to stop your extra salt. Try adding flavor to your food using herbs, spices, black pepper and lemon rice in place of salt when cooking. There are some tips diabetic patients should consider. Eat balanced meal, eat a reasonable amount of calories, eat regularly at right time, do not skip meals to keep your blood sugar level down and eat slowly. Try to maintain a healthy weight and engage in regular physical exercise. Weight loss may improve your cholesterol and triglyceride level both. And also it can reduce your blood pressure and your diabetes. Start with low intensity, short duration and gradually increase the intensity and the time. Gradually increasing intensity and duration of exercise is important. Be careful if you already have complication of diabetes. Aerobic exercise such as walking, fast walking, swimming, cycling is recommended for patients more than 3 days a week. So next point is medical treatment for diabetes. Take your medicine exactly as prescribed by your doctor. Eat meals and take medications regularly at right time. always remember that there is a risk of hypoglycemia if you delay your meal time or eat less than usual. Medication must be stopped by healthy eating and regular physical activity. Quit smoking and stop harmful use of alcohol are especially important. Unfortunately, many patients who have diabetes smoke. Smoking increases the risk of developing type 2 diabetes and diabetic complication. It increases insulin need, increases the risk of hypoglycemia. Smoking cessation is essential part of diabetes care. Cope with stress as best as you can. Stress is known to raise blood sugar. Instead, try meditation, deep breathing exercise, or another relaxation technique to beat stress in a healthy way. Quality sleep is very important and another key goal for good heart health. So, getting 7 hours to 9 hours of sleep is must. The bottom line is diabetes can lead to serious medical complication including heart disease, and you may manage the condition with medication and lifestyle changes. Avoid most common diabetes complication with preventive tips. So guys, in nutshell, I will always recommend you take your, as early diagnosis of diabetes is very good for heart. What we have seen is the people who have been diagnosed as early as possible, the risk of heart disease is less. So guys, I will focus on regular screening of diabetes every year. The patient who are hypertensive should get their annual screening for diabetes, because early diagnosis means the lesser risk of heart attacks. So guys, take your medications properly, take on time, regularly meet your doctor. That is the most essential thing. Your life is long provided you take the suggestion of your doctor and abide by your medicine which has been prescribed. Thank you so much.